most of the people think they don't need a contraceptive, they don't need a birth control pill. Truly speaking, it is a problem of every sexually active woman that she wants to conceive when she really wants to. She wants to avoid, or she wants to avoid the pregnancy when she is not really keen on. Birth control pill, they are so really important, but there are so many myths and so many facts that I would like to clear in this video for you. I am Dr. Shilpa, consultant gynecologist at Harley's Clinic, Mumbai. In this video, I would talk about the most common things that I see in a regular practice, about what people feel about contraception, what is their myths, what they usually talk about it, and what exactly is a fact about a contraceptive. Most commonly, what I get to hear is people say we don't need a contraceptive. It's just our first time. We really don't know whether we'll be able to do it or not. Well, every woman who is menstruating can get pregnant. You will not know when you get pregnant because sperms really are microscopic structures. They move. You are thinking that you want to try for the first time, but that first time should be a happy thing, not a terrible experience later on. Second questions that I see commonly is, I don't need a birth control pill because we are going to have sex during our safe days. See, we have talked mostly about the fertility periods, that it is good for a lady to get pregnant, especially to have intimacy during the central part of the cycle. She is likely to ovulate on the 14th day. But we never talk about that on the other days, if she does, she won't. She can get pregnant. So the ovulation depends upon so many factors. It can happen sometimes early, it can happen sometimes late. But if you had intimacy in the first half of the cycle, sperm can stay for 3-4 days inside the reproductive system, and they are already waiting for the the egg to come, and the lady can get pregnant. So if I can say, there are no safe days in the cycle. Every day the lady can get pregnant. If you don't want to get pregnant, all the precautions should be followed regardless. Now, after this thing, the usual questions come. Can we be sexually active during our periods? And if we have sex during the menses, we won't get pregnant, because it is surely a good time to have intimacy unprotected. The fact is, it's very difficult. Really, it is true that during periods the chances of conception is difficult. But when we say chances, again, it's not a foolproof way. Lady can get pregnant, especially women who have got a smaller length cycle. They can really get pregnant during the sex that happen during the menstrual. One more question that I see, they say we don't engage in penetrative sex, that's why we don't need a birth control pill. Surprisingly, in practice, I have seen people with intact hymen and still getting pregnant. Again, if the ejaculation happens near to the vagina, if sperms, which are very motile, they really know where they have to go. Sperms and egg attract each other, so even if the ejaculations happen on the vulva, vagina, clothes, fingers, it can still go to the egg, because this is how the nature of sperm is, this is how the nature of egg is. So being careful and not just thinking that penetrative sex is the only way that can be the reason that they should choose. Next question would be, I don't need a birth control pill, my partner pulls out. This is a very common way that we hear, The pull-out method was usually used by earlier men to restrict the number of the number of the children. Now, when you really don't want any pregnancy, we are not talking about the risk. Even with the pull-out method, 25 out of 100 women would still get pregnant. Ejaculation requires a lot of, I would say, the man needs a training, or how he will manage with control or discipline to pull out on time. Sometimes even the pre-ejaculation secretions have certain sperms, or some sperms, which can get a lady pregnant. What I hear again, another question, very commonly. So after the intimacy, the lady says that I go to the washroom, doctor, I have douched myself, I pass urine immediately, I wash my private parts, and I know that I have cleared up all the secretions, and I can't get pregnant. See, sperms are very smart creatures. They are very small. You cannot say that you have really taken out all the sperms by simply washing it. So, and the speed at which the sperm reaches the egg, by the time you go to the washroom, by the time you do it, you really don't know whether they have actually already gone there to fertilize the egg. So, this again is not really an effective way. Another question which we hear is, I have PCOS, and doctor, everybody tells me because I have PCOS, I won't get pregnant, so I don't need a contraceptive. Really? The first myth is that PCOS itself is not a contraceptive. PCOS in the lady has irregular periods, no doubt, but the ovulation is erratic, and that is why the periods are irregular. When we talk about erratic ovulation, she still can get pregnant at the time that we don't expect it to be. So accidental pregnancies are more common in PCOS people, because the predictable value of the cycle is really not there. Choosing a good contraception for such people who have irregular periods is rarely required. People say, I am breastfeeding and I don't need a contraceptive. True, actually. When you are exclusively breastfeeding and you are not having your periods, it acts like a contraceptive. But in that, when will you actually start having ovulation and finally have the periods? Which month we can assume it would happen? It can happen on 3rd month, it can happen on 5th month. So the exclusive feeding is a contraception, but when that exclusive feeding turns into weaning, that usually happens after 6 months that we start feeding the child, it can still give rise to failure, and the lady can have an accidental pregnancy. So no way, it is the only way that we can rely on it. There are other ways. The lady say, the elder lady, now I am about to get menopause, or I have got the menopause, I don't need a birth control. See, when we say menopause, the lady already has no periods for a year. But according to the literature, the erratic ovulation sometimes can still happen. So contraceptive requirement, at least in that age and probably a year after, is still needed. The other question that I see is sexual intimacy during pregnancy. Can we avoid contraception? So the good point, yes, a lady when she is pregnant, she can't get pregnant again. But there are certain reasons in which we say that the sexual intimacy during pregnancy won't be a good idea. If there is already some pain, some bleeding, if the os is small, we have put in a knot, or any type of infection. So even following safe sex practices, because if the partner has sexually shared infection, the lady can still get one. So using a good contraceptive, it's like a barrier one during intimacy, during pregnancy also is a good thing to do. Most of the people say birth control pill, if we use, would cause infertility to us. See, contraception is to avoid the pregnancy. Nowhere it is supposed to decrease the fertility. Maybe some fertility issues were already there, but contraceptive, even a birth control pill or a copper T, are not supposed to decrease the fertility anyhow. We talk about that fertility issues to our young ones would promote the sexual irresponsible behavior. I would say that if the young ones are ready to know about the contraceptive, they already are responsible people. this would, the willingness to learn about the contraceptive itself is a good thing to do. I hear next question would be, people say I pill is a birth control pill. See, I pill is not a birth control pill. I pill is an emergency contraceptive which is being taken in case the condom broke, leaked, ruptured, person has left the birth control pill in between, or some sort of an accident that has happened. Otherwise, it is not that you don't use a condom and rely I pill as a contraceptive. People say we use condom as a contraceptive. See, condom is a good way to avoid sexually shared infections, but people do get pregnant in spite of using a condom. 9 in 100 women would conceive over a period of 1 year with using condom as a contraceptive. I think it's a high time that we talk in details about what options you have about a good contraceptive. Conceive when you really want to. Accidental pregnancies can be really taken care by using a good contraceptive. I would be happy to answer if you have any doubts, any query. Please share with me on the comments below. You can also reach out to me via contact details given in the screen. Before you go, please do subscribe to my channel, hit the bell icon and select and to receive more notification of more such video. I hope you find this video informative. Thanks for watching.